Well, good afternoon, everyone, and welcome to the COVID-19 update for Thursday, December the 3rd. Before we begin, I want to offer a warm welcome home to 185 soldiers of the 2nd Battalion, 130th Infantry Regiment of the Illinois National Guard, who have spent the better part of the last year serving in the Middle East. They, along with their counterparts who returned in November, together 400 troops strong, have lived apart from their loved ones since January, with the added stress of being an ocean apart during a pandemic. On behalf of the state of Illinois, I wish them a safe and happy reunion during this holiday season. We are very, very glad to have you home. Yesterday, as the nation reached 100,000 hospitalizations from COVID-19, thousands higher than either our spring or summer national peaks, the director of the CDC, Robert Redfield, warned that as we wait for mass distribution of a vaccine, the months ahead could amount to the most difficult in the public health history of this nation. That makes our collective action in the coming weeks all the more important. What can we do to support our healthcare systems? How do we make sure that they're able to care for all the patients who come through their doors? Not just the current surge of COVID-19 patients, but also severe flu cases, car crash survivors, those suffering from heart attacks or strokes. Everyone knows the basics, of course. Wash your hands, keep your distance, wear your mask around others to protect yourself and to protect your family. And right now that includes working extra hard to stay home as much as we can to bring down rates of transmission in our communities. Getting your flu shot will also help more people out of the hospital, easing the burden on our healthcare workers. One very important thing that you can do to help others right now is to donate blood. It has no effect on your immune system to do so, and hospitals need blood right now more than ever. It's normally difficult to get blood donations around the holidays, but the pandemic has made it even harder to maintain an adequate blood supply. On top of COVID patients, there are still patients in need of transfusions all across the hospital, including those who need surgery, are undergoing cancer treatments, have chronic conditions such as sickle cell, or for those who experience accidents or trauma. Additionally, many of our blood donation centers, including the Red Cross, are collecting convalescent plasma from people who are healthy and were fully recovered from COVID-19, as their antibodies may help patients who are actively fighting the virus. Research into plasma as a treatment for COVID-19 is ongoing, but since this is a new virus, the more information we have to study, the quicker we can find meaningful answers about its effectiveness. In other words, the more people who have recovered from COVID-19 who donate their antibodies, the better our ability to save lives. Across the state, our blood donation centers and our hospitals are making loud and clear their need for more assistance during this holiday season. So I'm very glad today to be joined by someone who has made a career in this work, making it possible for countless lives to be saved, all because someone took the time out of their day to give back by giving blood. And so I'd like to introduce the CEO of the Red Cross Illinois region, Selena Roldan. Selena?
Thank you, Governor Pritzker, and thank you, Dr. Ezike, for your steadfast leadership at this time. At the Red Cross, we are grateful for the medical professionals, first responders, and those providing essential services. This includes the dedicated phlebotomists and individuals who collect life-saving blood each day. Every 2 seconds, someone in the United States needs blood. The COVID-19 pandemic does not change the Red Cross mission. During this holiday season, as the weather gets colder and people shelter in place, the Red Cross must continue to hold blood drives across Illinois and supply hospital partners with life-saving blood. Blood collection is an essential service and is critical for surgery patients, those undergoing cancer treatment, people with conditions such as sickle cell, and those who experience trauma. The Red Cross staff trained staff follows thorough safety protocols and guidance from the CDC and public health authorities and have in place safety precautions such as social distancing, temperature checks, wearing masks, and enhanced cleaning guidelines. Healthy individuals are needed to schedule an appointment to donate life-saving blood, and organizations and businesses are still needed to host blood drives. If you are fully recovered from COVID-19, your donation is also needed. You are needed to donate your plasma to help patients currently battling the virus. Convalescent plasma is a type of blood donation collected from those who have recovered from COVID-19 and has antibodies that may help patients actively fighting the virus. As part of this effort, the Red Cross is also testing every blood donation for the presence of COVID-19 antibodies, and those donations may also now be processed into a convalescent plasma product to help patients battling this virus. We are asking everyone that is feeling healthy and well to please make an appointment to donate. Appointments ensure social distancing and limit walk-in donors. Blood donations will be needed in the days, weeks, and months to come. You can make an appointment to donate by visiting redcross.org or by calling 1-800-RED-CROSS. Two of the most important ways that you can help at this time is by rolling up a sleeve to donate blood or by becoming a Red Cross volunteer. Thank you to everyone who answers the call. I now have a brief statement in Spanish. Cada 2 segundos, alguien en el país necesita sangre. La pandemia de COVID-19 no cambia la misión de la Cruz Roja. En esta temporada, a medida que el clima se pone más frío y las personas se quedan más en sus hogares, la Cruz Roja debe continuar realizando campañas de donación de sangre en Illinois y suministrando sangre a los hospitales para salvar vidas. Necesitamos que personas sanas donen sangre. Visite redcross.org o llame 1-800-RED-CROSS para hacer cita. Necesitamos el apoyo de organizaciones para realizar campañas de donación de sangre. Nuestro personal sigue protocolos estrictos de seguridad y recomendaciones de los CDC. En la Cruz Roja estamos recolectando plasma de personas que se han recuperado de COVID-19 para ayudar a los pacientes que luchan contra este virus. Además, estamos haciendo pruebas de las donaciones de sangre para detectar la presencia de anticuerpos de COVID-19. Gracias por su apoyo. Now I would like to introduce Dr. Ngozi Ezike, who will make her remarks.
Good afternoon. I want to touch on the quarantine timeframes, as I know there are questions about the new guidance. The previous guidance from the CDC was for individuals who had been exposed to someone with COVID-19 to quarantine for 14 days. However, in further study and extensive modeling by CDC and other academic institutions, the CDC has now reduced that to 10 days as long as the individual does not have any symptoms at all. This does not mean that the person can't develop symptoms on day 12 or 13, but we know from looking at all the data that the risk of that happening is between 1 and 10%. Alternatively, a person can discontinue quarantine at 7 days if they have no symptoms and they have a negative test in the preceding 48 hours. So if you are a close contact of someone with COVID and on day 5 you get tested and that test comes back negative on day 7 or day 8, you can end your quarantine at that time. You still have to quarantine between the time you took the test and when you get that negative result. Remember, you must have no symptoms whatsoever. Again, the hope is that by reducing the amount of time in quarantine, it'll be easier for people to take this critical action without the additional economic hardship of not being able to work for so long. And better adherence to these quarantine guidances can help reduce stress on communities by decreasing the number of new infections. For today, we are reporting 10,959 new individuals with COVID-19 for a total of 759,562 total people in Illinois who have been diagnosed with COVID-19. In the last 24 hours, we have received reported IDPH of 192 additional lives lost for a total of 12,830 lives lost here in Illinois. Overnight, 5,653 individuals were in the hospital with COVID-19, and of those, 1,170 were in the intensive care unit, and 693 were on ventilators. In the last 24 hours, 106,778 tests were reported for a total of 10.8 million tests since the beginning of this pandemic. I would like to remind people that our path forward starts today with what we choose to do and our actions for today. I want to thank everyone who is making the sacrifices, who is wearing their mask, who is foregoing group activities. With continued actions like yours and others following your lead, we can turn this around. Let's choose to protect and not infect those around us by avoiding the gatherings and wearing our mask and washing our hands. Let's continue to keep our distance, again, at least 6 feet between each other. And if you haven't obtained your flu shot, please do that as well. Thank you. Buenas tardes. Quiero volver a hablar de la duración de cuarentena, porque sé que hay preguntas sobre nueva información que se acaba de publicar. Inicialmente, la guía era para personas que fueran expuestas a alguien con COVID-19, tenían que estar en cuarentena por 14 días. Sin embargo, en nuevos estudios y modelos exhaustivos realizados por el CDC y instituciones académicas, el CDC lo ha reducido a 10 días, pero solo mientras el individuo no presente ningún síntoma. Esto no significa que la persona no puede mostrar síntomas en el día 12 o 13, pero el riesgo de eso es entre 1 y 10%. Alternativamente, una persona puede suspender la cuarentena después de 7 días si no presenta síntomas y ha resultado negativo en las 48 horas anteriores. Por lo tanto, si usted es en contacto cercano con alguien con COVID-19 y el día 5 de esa cuarentena se hace la prueba y esa prueba es negativo, puede finalizar su cuarentena después de 7 días. Sin embargo, si no tiene los resultados de la prueba para el día 7, deberá permanecer en cuarentena hasta que reciba los resultados negativos de la prueba, o hasta el día 10, lo que sea más corto. Recuerde, no debe tener ningún síntoma en ninguna de las situaciones. La esperanza es que al reducir la cantidad de tiempo de cuarentena, será más fácil para las personas tomar esa acción crítica sin las dificultades económicas de no poder trabajar. Una mejor adherencia a las pautas de cuarentena puede ayudar a reducir el estrés en las comunidades al disminuir el número de nuevas infecciones. Hoy informamos 10,959 nuevas infecciones por COVID-19 para un total de más de 759,000 casos en Illinois. Desafortunadamente, esto incluye 192 vidas perdidas para un total de más de 12,800 muertes aquí en Illinois. Desde anoche, 5,653 personas estaban en el hospital con COVID-19 y de ellos 1,170 pacientes estaban en la unidad de cuidados intensivos y 693 personas están en ventiladores. En las últimas 24 horas se han reportado más de 106,000 pruebas para un total de más de 10.8 millones de pruebas aquí en Illinois. Me gustaría recordar a la gente que nuestro camino a seguir adelante comienza con lo que hacemos hoy. Gracias a todos que han hecho todas las mitigaciones. Tenemos que dar eso y continúa, pero lo tenemos que hacer todo juntos, porque solos no podemos. Muchísimas gracias para su apoyo, and with that, I'll turn it back over to Governor Pritzker.
Thank you very much. Happy to take questions from members of the media.
Governor, could you first of all talk about one of the big issues of the day, this hotel up in Northbrook? As you're aware, there was the big wedding up there, 150, 200 people. Can you give us, first of all, your reaction to that, and tell us what kind of actions the state might take in response to that to deal with this?
Well, first of all, I'm deeply concerned for the people who attended that wedding. I understand that people were in very close proximity from one another. I understand that those people will go home or back into their communities and may have infected other people. And this is very concerning to all of us. At a moment when we have rampant COVID-19 throughout Illinois, community spread, here we have people who are in a concentrated fashion have the ability now to go spread it to everywhere that they return to. So I'm deeply worried for them and for the communities that they've returned to, for their families and so on. I hope that each of them will isolate and get a test. Now, as far as what should happen, what we've done, we contacted the Cook County Health Department and other authorities in Cook County, as well as the city of Chicago. And, we've made sure that they're following up on this. It is their local enforcement that is very important to us, and they are indeed doing just that. I saw in the latest news story that Cook County is now following up with potential legal action, law enforcement action. So we'll have to see what follows here, but I certainly want to encourage them to do that. We've put in place the rules and regulations for them to follow up on this.
But this has got the fact that we were told that this wedding was planned long before Tier 3, and then even when you put Tier 3 in, they decided to go forward with
Right.
it. The fact that they're flaunting it like this, I mean, it's got to be...
It's very irresponsible, and it's also irresponsible of the hotel to host an event like that. They, too, have breached the rules, and they should be held responsible.
Ohio, Massachusetts, California, Illinois all stopped indoor dining. When we're done with Tier 3 mitigation, maybe going back to Tier 2, which will happen hopefully someday, have you thought about reopening the schools first rather than the restaurants and bars?
Amy, I know that you keep reporting that somehow we've closed schools. I have not closed schools. So that's just that's a fallacy.
I know it's up to superintendents.
It is, and all across the state, parents, teachers, local school councils have made decisions for themselves based in part upon how rampant the virus is in their county, in their area, based in part on how rampant it is among the people who attend that school or their families. And I think, for the most part, school superintendents, the school councils, parents, faculty, et cetera, have been responsible about that. We have many people who are learning from home because that's what their communities felt was right to do. We also have many people who are in hybrid situations, which for some works very well. And then there's a smaller portion that are going to school every single day, because that's what they've deemed to be safe. But we're not keeping people from having school.
Last 2 days in Illinois have been the two deadliest days during this pandemic. Across the country, more than 3,000 dead, also the deadliest day for the U.S.
Yes.
How long do you think we should be prepared for these kinds of numbers?
Look, Eric, I don't know, but I can tell you that it is devastating. It's just devastating. For the country, it's devastating for the state of Illinois, for all of us who are very focused on trying to save people's lives. I can tell you that we're trying to do everything that we can at the front end of the process. Remember, by the time you hear of somebody having died, they got infected weeks earlier. Some of those, of the people who passed away, they probably went to the hospital at some point. Then they became an ICU patient. Some of them went on ventilators. And it's just, I look at it and I say, how can people not follow the mitigations, watching the number of people who are passing away, not just in the state of Illinois, but the thousands now a day across the United States. I just hope that people are heeding the mitigations that we're asking them to follow, because that ultimately is going to bring that death count down. You saw it. Just go back to the numbers back in April when the numbers were increasing. We hit a peak in about the 6th of May, roughly that. And then you saw the case numbers coming down. Then you saw the hospitalizations coming down, then the ICUs, and then deaths. Deaths are the last thing to come down. Unfortunately, just they lag all the other statistics. So, look, I don't know if there's any other thing that should be more powerful in people's minds about why they ought to follow the mitigations and stay home right now than the number of people who are passing away.
An age group on the number that have died, I mean, those are huge numbers, 216 yesterday,
Yeah.
192, which Eric said.
Yeah.
Do you have, are these mostly nursing home patients? Is there an age group breakdown? Do you have yet?
They're
Is
all
that
in the
on your
press
website?
releases that are posted every day.
Yeah, every day's
Anyone else
press
have
release
questions?
shows you the age, whether they're in their 60s, 70s, or 40s, and so on, and what county they came from. I don't happen to know that right here, but we'll be happy to provide you that press release so you can
We'll do
take
one
a
more in the
look.
room and then
Oh,
go
wait, a
online.
question about blood
Eric?
donations.
Yeah, just one question about hospitalization.
We'll come back to
They've
blood
come
donation.
down a little bit from the peak, maybe a little less than 10%, the
Yeah.
number of people in the hospital.
Yes.
But hospital bed availability has not gotten better. If anything, there are more regions below 20%. Can you explain that paradox? Does it have to do with staffing running thin?
It does. Remember that the way that we report the number of available beds is the number of available beds that can be staffed. And so, yes, that adjustment gets made based on staffing. And remember, you've got to give some reprieve, even in the height of this, right? When the numbers, you saw 15,000 cases a day and more people going into the hospital, even though we've come down about 10%. In the height of it, people are working double shifts. They're working all week long. We have to give these people a break at some point, right? And so, it's a good moment perhaps to take staff off of some beds that aren't filled. And so that's probably what you're seeing in terms of the adjustment of the number of available beds. I don't want to say we have a lot of beds available. I mean, we have beds, but people should not see that as some sort of invitation that we should, reduce mitigations and therefore fill up all the beds because, gee, there's a vacancy somehow. I don't want people to look at it that way. It's not true. I mean, the fact is that we have to bring down the hospitalizations overall because we don't have the staffing. If we do hit that height and hit sort of the full capacity, right now, there isn't any staff really to pull from other states or anywhere else.
All right, Wall Street Journal and New York Times are both reporting that 106 of 7,000 blood donations that were collected by the American Red Cross last year, December of 2019, came back positive for the COVID antibodies, which means it's been around here longer than we suspect. So when people donate blood, and I know a lot of people do want to donate blood, is their blood work going to be checked for antibodies? So I don't want to put you on the spot, but I just...
Sure. So yes, we are testing all blood at this point for, so if you come in and you donate blood, your blood will be tested for COVID antibodies.
All right, we've got to go online for questions. Dean Olson at the SJR, how is the state trying to combat the notion that the state is taking away personal freedoms with a mask mandate?
I'm surprised by the question just because this has now been around for quite some time, and I hope people understand that people may have the notion that we're taking their freedoms away, but the reality is there are laws on the books that in the course of a disaster, an emergency in this state, that the job of our government is to step in to try to reduce the disaster, to try to save as many lives as we possibly can. We've limited the kinds of mitigations that we've put in to the things that will actually have an effect on the virus, or at least on the number of people who will get sick from the virus. And we've even adjusted them over time to make sure that we're taking into account that certain things we've learned over the last 9 months would tell us that you can keep certain kinds of retail open at a certain capacity, and that they're unlikely, or it's less likely, lower risk that people will get the virus from that situation. So, look, it's science and facts. And I hope that when we put the science and facts out there, and we have throughout this, you've seen the doctors standing here, you've seen the studies that we've put out, you can read for yourself online or otherwise why those mitigations have been put in place. And, you know, there are people who don't want to believe them and want to say that we're taking their freedoms away, but that's not at all what we're doing.
Jake Griffin at the Daily Herald. Can Dr. Ezike describe children's ability to be inoculated with the current vaccines in the pipeline? Are these vaccines safe for children? And also, where do people over 65 not living in care facilities fit in the vaccination schedule?
Okay. You might have to remind me of some of the pieces. Regarding children, as of this time, we don't know that this will be approved for people under the age of 18. I think the majority of the people in the trials were over 18. There are special rules in terms of medical studies and enrolling kids. That's a special protected class, if you will. I did remember in trying to absorb all of the information, I did recall that after they had gotten the requisite number of individuals over 18, I did remember, and I don't know if it's Pfizer for sure. I remember someone being able to go and get some older teenagers that may have been enrolled. So I don't know if there was enough information from those participants that, of course, would have had to have an adult, a guardian consent. I don't know if there's enough information from that for them to lower the age at which this can be given to under 18. We will find out as the FDA rolls out their recommendations. We will get to know more about who it can be given to, from the lower age limit to is there an upper age limit. So those are pieces of information still yet to be finalized.
Where do people over 65 not living in care facilities fit into the vaccination schedule? So you could probably explain ASIP.
Yeah. So in terms of the guidance, in terms of the prioritization scheme, for sure the top priority, and again, everyone needs to get vaccinated. So if we have only 10% of the population vaccinated, we are not going to get where we need to go. But in terms of who should get it first, you know, there have been careful thought, including, as the governor has mentioned, you know, ethicists, scientists looking at the data, modeling, trying to see what happens when you immunize this group versus that group. We do know that the first group will be long-term care residents and hospital-related workers. Both of those groups are the #1 group to be immunized. Following that, we are waiting to get final word, but what we think is going to come out is that you're going to have people over 65, people with multiple serious comorbid conditions that we know the virus preys upon, and people who form the critical infrastructure of our society that allow us to continue to live our life as we know it, that help us to have food in the grocery stores, that make sure that sanitation is picked up. All of those will also be in that next tier, and if it's going to be that first group, 1A, and then a 1B or a 1C, or if all of that will be in 1B. We're waiting for those final recommendations, but those will be the next people in the next tier.
Ryan Boyles at Health News Illinois. Have we started to see any impact from the antibody treatments received from the federal government for hospitals strained by the high volume of COVID-19 patients? Do you know how many treatments the state has received so far?
Great. So we have had weekly shipments, and so this is another great thing, and I thank you for asking this question because it's really important that we get this word out. The monoclonal antibody infusions, these are for individuals who have tested positive for COVID and are in a high-risk category, which we think they could have a bad course. Again, these are people over the age of 65 or even in their 50s, but they have these high-risk conditions. Again, heart disease, a lung disease, kidney disease, obesity. So we have people that we know are high risk, and so infusing them with these antibodies. And there are two products that are out, one by Eli Lilly and another one by Regeneron. Regeneron is the one made famous by our president. And then the Eli Lilly product, the bamlanivimab, came out first. So these two products work similarly, have the same indications in terms of these high-risk individuals who can get it. You actually can give it to certain pediatric patients that meet certain criteria, that they fall in high risk, that they have sickle cell, that they have certain diseases that, again, portend a potentially bad risk, and they have to be at least 40 kg, about 80 pounds, 40 kilograms. So that this is available to people of, a wider, from 14 on up, and people need to know about it. We have not received a lot of doses. In our first shipment, we got about 6,000 doses. Remember that in a day, we report 12,000, 10,000 people, and we got 6,000 doses 1 week. Again, remember, we're identifying 10,000 people in a day. So if we're identifying 70,000 cases, but we got 6,000 in 1 week, this is not available to everyone at this point. But now with another product that's coming on board, we are having shipments of both the Eli Lilly product and the Regeneron product so that there's more. And so we're working with hospitals and infusion centers and even home health agencies to be able to get this product to individuals who'd be at risk, and including our nursing home populations, again, trying to avoid people even going into the hospital. This is supposed to help have a much milder course. Once you're already in the hospital, you can't use this. Once you're already requiring oxygen, you can't use this. If you're more than 10 days out from when you started your illness, you can't use this. So it needs to be used early to get the maximum benefit, and we hope to keep getting more, and when it's available, we'll probably use our resources to buy as much as we can and get this into as many people, and we're working on the partnerships with different hospitals and infusion centers to make sure that this is available in its limited capacity throughout the state.
Dean Olson at the SGR, I messed up his question and forgot the second half of it.
Oh.
How is the state altering its messaging campaign on masks, social distancing, travel, and gatherings as end-of-the-year holidays approach in light of the fact that so many people disregarded this advice in the days before, during, and after Thanksgiving?
Well, we're making sure that we're getting, particularly as we approach the rest of the holidays of December, trying to get it out even kind of wider and deeper. It's not that people necessarily saw it and specifically ignored it. I think there are people who, who may not have realized what it is that they were portending for the state and for themselves when they went to a Thanksgiving gathering that they had been hoping to go to. I do think that people are making different plans for their Christmas holiday or for Hanukkah or other celebratory holidays. And so I'm very hopeful anyway that we can divert people from having large family gatherings so that we don't have yet a third surge on top of this potential second surge.
Jamie Monks at the Tribune. How will the state prioritize incarcerated people in the vaccine distribution, and how will Illinois secure its vaccine to make sure it goes to the people on the priority list without being diverted?
What was that second part of it? Sorry.
How will Illinois secure its vaccine to make sure it goes to the people on the priority list without being diverted?
Diverted. Huh. Well, let's start with we're waiting for ACIP to do the rest of its work on the other populations beyond those that will be served by the early delivery of vaccines. We're getting, as you have heard, 109,000. That's the latest number that will arrive perhaps between the 13th and the 19th of December, and then there will be hundreds of thousands of others that might come, assuming that there is approval of both of those vaccines, Pfizer and Moderna, before the end of the year. And that still won't cover all of the people who are in phase 1A. as it's been referred to and as Dr. Ezike referred to it. We obviously, at some point, we want to make sure that the congregate settings, even people who are in prison, who are actually held in very close quarters, we want to make sure that they get vaccinated too, and of course the folks who work at our prisons as well. But we're going to listen to the CDC and ACIP as we make decisions about that.
We got a lot of different vaccine ones, so I'm just going to put Andy and the Tribune had another question together. Sources are telling Peoria will serve as a distribution hub. Can you confirm this? And why was Peoria chosen as that site? And what are you doing to protect the vaccine and make sure that it's secure?
Yeah, and I know that was the other part of the question before. Let's start with the SNS. We're simply bringing the vials of the vaccine that get delivered to Illinois to our strategic national stockpile in Illinois. That's just what you do when you receive, whether it's PPE for distribution across the state or any other item. This is obviously a very important one, as PPE was early on in this, and as it still is. And so that's what the strategic national stockpile is intended to be for. In terms of securing it, I'm not going to talk about what the security plans are here at a press conference or at any press conference, but suffice to say that there are plans for security, and obviously the Emergency Management Agency led by General Alicia Tate Nadeau, working together with state police and other authorities, will make sure that the vaccines get to where they're supposed to get to.
Rachel Hinton at the Sun-Times, with Mayor Lightfoot suggesting more or less that Speaker Madigan step down as Speaker, more than a quarter of the Democratic caucus saying they won't vote for him. Is it time for Madigan to step down as Speaker?
Well, as I've said, it is the obligation of the leader of the House of Representatives, of anybody who serves in a role that has an impact on the entire state, the way that Speaker, Senate President, Governor, et cetera, have, that answering questions is the very first most important way to be transparent in a job in which integrity is extraordinarily important. And so I have called already for the Speaker to answer those questions or resign.
If I can follow up with that, the Speaker has refused to answer questions. He's obviously not heeding your advice, and he wouldn't even put out a new statement the other day. You're stopping short of calling for him to actually step down.
I've been very clear about what my views are, and you're going to hear in the next, I think, 4 or so weeks, 6 weeks perhaps, from the members of the House of Representatives who ultimately will make the decision about whether the Speaker will be leaving office.
Molly Parker at the Southern Illinoisan, this is for Dr. Ezike. Today, the SIU Board of Trustees voted to grant you an honorary degree, Doctor of Community Health, for your work during the pandemic and beyond. Could you share your thoughts on receiving this honor?
Is that news?
Thank you to I am grateful for this, and I receive it in the name of the incredible people at IDPH who work so hard to make IDPH and put our state in such good stead under the leadership of Governor Pritzker. So thank you so much for that honor. Thank you.
Mike Militich has a question. A Missouri county bordering Illinois tracks reinfection rates and started sharing that information with the public. Is Illinois tracking the reinfection rate as well? And if so, where can people find that information?
We don't have a case yet here of documented reinfection. We will be able to know that, and then we will find a way to represent that on our website, because I know that's important information. We have seen reports around the world of increasing numbers of cases of people with clearly documented infection earlier this year and now having a second. So again, what that tells us is that we're not clear on the duration of these antibodies once someone is infected. Again, the duration of the antibodies in one individual might not be the same for another. So for someone, maybe it's longer, and some people it's shorter. So again, please understand with this novel, meaning new coronavirus, there are questions that have to be answered with the tincture of time. As we go further along, we will know more. So we can't know everything about this new virus the day it hits, the year it hits. With time, we will learn more, and we'll share as we learn.
Shia from Politico will be our last question today. What is your office doing to prepare for the upcoming legislative session in January in terms of the budget, black agenda, and ethics?
Well, we've been preparing for the legislative agendas for the legislature to get together for months now. Our anticipation had been that they would get together in November, as was originally planned. So as you can imagine, having a little more time, I've put out principles for energy legislation. I've put out principles for legislation around both criminal justice reform and addressing racial inequality in our state. I've been very clear about ethics legislation. I started, with very clear principles back when I gave my State of the State address at the beginning of 2020. And I have reiterated not just those points, but others. It is time for us to rid this state of the unethical characters that hold office, and we need to have laws on the books that address the things that we have learned that have been taking place in our state. Things like making sure we have lobbyist disclosure, making sure that we have ethics, particularly around any energy legislation that takes place in this state, and that's where a lot of what you've heard about recently has come from, on both sides of the aisle, I might add. And I also would say that it's ridiculous to me that somebody can serve in the legislature and turn around and become a lobbyist the next day, a consultant, a lobbyist, to get legislation passed. And so we need to have, we need to make sure that we have legislation that addresses that kind of thing. There's a lot to do, and so, I hope that we'll be able to work together with the legislature beginning right away in January.
All right, thanks, everyone.